Health Talk made simple by Aziz. Welcome to your simple guide to kidney health. Tucked away in your body are two of its most vital and hard-working organs, yet they often go unnoticed. Today we're shining a spotlight on your kidneys, the body's master chemists and purification system. These bean-shaped powerhouses are located on either side of your spine, just below your rib cage. Interestingly, your right kidney usually sits a little lower than the left to make room for the liver. Despite their huge responsibilities, each one is only about the size of your fist. And while we have two, our bodies are incredibly resilient. One healthy kidney has enough capacity to do the job all on its own, which is why living kidney donation is possible. Having two provides a powerful backup system. Think of them as the most advanced smart filters you can imagine. They don't just mindlessly strain your blood, they perform a delicate balancing act, 24 hours a day. Their primary role is to remove waste products and toxins, get rid of extra water, and turn it all into urine to be flushed away. But their job description doesn't stop there. They also play a crucial role in controlling your blood pressure, activating vitamin D to support strong bones, and even telling your body when to make new red blood cells. They truly are the unsung heroes inside us all. To do all this, they connect directly to the body's main blood highway, the aorta and vena cava. This constant, high-volume flow allows them to continuously monitor and fine-tune what's in your blood. They ensure the perfect balance of water, salts, and minerals like sodium and potassium, keeping your body's internal environment stable so your cells can thrive. The sheer scale of their workload is staggering. Every single day, your kidneys filter about 200 liters of blood, removing around 2 liters of waste products and excess water. That means your entire blood supply gets a full cleaning service dozens of times a day. So, how exactly does this incredible journey of blood purification happen? Let's follow the path of blood as it moves through these amazing organs, step by step. To grasp kidney magic, follow the path of your blood. It begins at the renal artery off the aorta. About 20–25% of each heartbeat goes to your kidneys. That steady pressure brings wastes to be cleared. Arteries branch like a tree, shrinking to hair-thin vessels, ending in about 1 million nephrons per kidney. Each nephron sorts out what to keep and what to lose. At the start is the glomerulus, the main filter. Pressure pushes small stuff through: water, salts, and wastes like urea. They collect in Bowman's capsule. Big parts stay in the blood: red cells, white cells, and important proteins. The filtrate travels along a winding tubule, where cells take back what your body needs: water, minerals, and glucose. 4 pillars: waste removal, fluid and electrolytes, blood pressure, and hormones. Pillar 1. Removing wastes from metabolism, especially urea from protein breakdown. Kidneys are the main exit door for toxins. Pillar 2. Balancing water and minerals. They adjust sodium, potassium, calcium, moment by moment. Drink a lot? They dilute urine. Dehydrated? They conserve water. This balance keeps nerves firing and muscles working. Pillar 3. Blood pressure control. They set blood volume by managing fluid. When pressure drops, they release renin, which tightens vessels and saves salt and water, bringing pressure back to normal. Pillar 4. Hormones beyond blood pressure. They activate vitamin D to keep bones strong. They make EPO, telling bone marrow to produce red blood cells. Too little EPO can cause anemia, fatigue, and weakness. Together, these pillars keep you in balance, the core of everyday health. Your kidneys are the ultimate multitaskers, working non-stop, 24/7, even while you're fast asleep. They are constantly fine-tuning your body's internal environment. They intelligently adapt to everything you eat, drink, and do, ensuring your body remains in a state of perfect balance, or homeostasis. Every single day, they filter an astonishing 180 liters of fluid. That's roughly 45 gallons. To put that in perspective, your body only contains about 3 liters of plasma. This means your entire blood supply gets a full cleaning service about 60 times a day. That's a complete cycle roughly once every 30 minutes. This incredible efficiency relies on a 2-step process. First, filter almost everything out, then selectively reabsorb what the body needs. About 99% of the filtered fluid is reclaimed, leaving only 1 to 2 liters to be excreted as urine, carrying away metabolic waste. But what happens when this system falters? Humans are born with a huge amount of what's called renal reserve. This means your kidneys can lose a significant amount of function before you'd ever feel a thing. The healthy parts of the kidneys simply work harder to pick up the slack. Because they compensate so well for so long, problems often stay completely silent until they are quite advanced. This is why chronic kidney disease, or CKD, is known as a silent killer. By the time symptoms appear, significant damage may have already occurred. These signs can be vague and easily dismissed. Persistent fatigue, swelling in your legs or ankles, foamy urine, or needing to urinate more often, especially at night. This is why routine screening is so critical. A simple blood test measures creatinine, a waste product, to calculate your estimated glomerular filtration rate, or eGFR. This number tells your doctor how well your kidneys are filtering. Doctors use this eGFR to classify kidney function into 5 stages, from G1, which is normal function, down to G5, which indicates kidney failure. Additionally, a urine test can check for a protein called albumin. Its presence can be one of the earliest signs of kidney damage, long before your eGFR starts to drop. For those with risk factors like diabetes, high blood pressure, or a family history of kidney disease, regular screening isn't just a good idea. It's essential for catching trouble early and preserving your long-term health. As we journey through life, our bodies change, and our kidneys are no exception. It's completely normal for kidney function to dip slightly with age. Think of it as a natural, gentle slowing down that happens over many decades. This process is typically mild and very gradual, a testament to the kidney's incredible resilience. However, it's crucial to distinguish this from a problem. A sudden or significant drop in function is never a normal part of aging. If you or your doctor notice a sharp decline, it signals that something else is at play and needs to be investigated right away. So, what's happening inside? Over time, some of the tiny filtering units, the nephrons, simply retire from service. The filters themselves can develop microscopic scars, a condition called glomerulosclerosis. This scarring makes the filters less efficient at cleaning the blood. Simultaneously, blood flow to the kidneys may slow down as the vessels that supply them become a bit stiffer. This gradual decline in filtration often begins after midlife. Hormonal responses also shift. The RAAS system, which regulates blood pressure, can become less responsive. The kidney's ability to activate vitamin D diminishes, which can affect bone health. And production of erythropoietin, or EPO, can decrease, sometimes leading to anemia and fatigue. Older kidneys also become less adept at concentrating and diluting urine. This makes older adults more vulnerable to dehydration, especially in hot weather or during illness. Because of these changes, it's vital to watch for new symptoms. Pay attention to swelling in your legs or ankles, foamy or dark-colored urine, or a new need to urinate frequently at night. If you notice any of these, it's time to see your clinician. The good news is, you have immense power to protect your kidneys. Let's walk through the most effective strategies. Tip 1. Control your blood pressure. High blood pressure is a leading cause of kidney damage. Work with your doctor to set a personal target and consider monitoring it at home. A simple micro habit is to read food labels and actively choose low-salt options, as this directly helps manage pressure. And always take your medications exactly as directed. Tip 2. Manage your blood sugar. Just like high blood pressure, uncontrolled diabetes can seriously harm the delicate filters in your kidneys. Follow your meal plan, incorporate daily physical activity, and use medications consistently to meet the goals you've agreed upon with your healthcare team. Tip 3. Hydrate wisely. Staying hydrated helps your kidneys flush out waste. Aim for regular small sips of water throughout the day rather than drinking large amounts all at once. Your individual needs can vary, so always adjust based on specific advice from your doctor, especially if you have heart or existing kidney conditions. Tip 4. Practice medicine safety. Some common over-the-counter drugs, like non-steroidal anti-inflammatory drugs or NSAIDs, can harm kidneys if used long-term. Avoid them unless specifically advised by your doctor. Always ask your pharmacist or doctor if any new prescription requires a dose adjustment for your level of kidney function. Tip 5. Get your routine labs done. Kidney disease is often silent in its early stages. Regular screening is key. This usually involves a simple blood test to check your creatinine and calculate your eGFR, plus a urine test to measure the albumin to creatinine ratio, which checks for protein leakage. Tip 6. Move daily and maintain a healthy weight. Regular, moderate exercise like a brisk walk supports healthy blood vessels and helps control both blood pressure and blood sugar, all of which benefits your kidneys. A kidney-friendly diet is powerful. Focus on eating mostly whole foods, fruits, vegetables, whole grains, and lean proteins. It's important to get enough protein, but not an excessive amount. Your clinician or a dietitian can give you a personalized recommendation. Actively cut back on ultra-processed foods and high-salt items like canned soups, frozen dinners, and cured meats. Get into the habit of reading nutrition labels and choosing options labeled low sodium. If you smoke, quitting is one of the best things you can do for your kidneys. Smoking damages blood vessels everywhere, including the delicate ones in your kidneys. Limiting alcohol intake also helps protect your kidney filters and manage blood pressure. Be your own best advocate. Keep an updated list of all your medications, including supplements and over-the-counter drugs. Bring this list to every single appointment and review it with your doctor. And if you ever need a medical scan with contrast dye, always ask if it's safe for your kidneys first. Finally, stay current on your vaccines, especially for the flu and pneumonia. Preventing infections is a proactive way to avoid the acute stress they can place on your kidneys. Remember, what's good for your heart is good for your kidneys. But always be prepared to seek urgent care for red flags like sudden swelling, shortness of breath, a spike in blood pressure, producing very little urine, or any concerning side effects from your medicines. Your kidneys work hard for you around the clock. These simple, consistent habits are how you can work for them. They clean blood, balance fluids, control pressure, and make key hormones. Damage can hide for years due to kidney reserve. Anyone with diabetes, high blood pressure, heart disease, or family history. Control BP and sugar, hydrate wisely, be med-smart, stay active, and get checkups. Small steps, done daily, lead to big results. Schedule your kidney check today. Your health is your greatest asset. Protect your kidneys to protect your life. Health Talk made simple by Aziz. If this helped, subscribe and share. Stay well, and see you next time.